You've been diagnosed with long COVID, time's going on, but you've still got brain fog, fatigue, muscle aches. Why are you not getting better? Why is this long COVID just persisting? Well, coming up in this video, I'm going to cover why exactly the reason is you're not getting better from long COVID. 2, the limitations of the current treatment for long COVID. And 3, what would I do? What would I do with patients? So let's get into it. First of all, we've got to understand, paint the picture of why you're not getting better, the real underlying issue. Now, imagine for a moment there's an iceberg. This is something we use in naturopathic philosophy, talking about holistic treatment and combining everything together. But just picture an iceberg for a minute, and there's the tip sticking out. These can be classed as the symptoms. So that shortness of breath, the fatigue, the muscle pain, the POTS, they're all the symptoms expressing in your body as it's gone on, and you're looking at those symptoms thinking, why have I got this fatigue? What can I do? Now, the current treatment and the medical model is to think, well, fatigue, we'll give some stimulants, you need more rest. It's just all very symptomatic. The things underneath the water, they're the reasons why you're getting those symptoms. Now, if we go under the water, we can think of further things like inflammation, gut microbiome health, genetic predispositions. And these things under the water are really the secret of getting to the root cause of those symptoms higher up, sticking out of the water. And this is what we're going to talk about in further detail. Now, I've got a page here that we'll look at deeper. Now let's look at this picture. It's optimal wellness versus normal health. It's really important to understand these key philosophies to unlocking the reasons of why you're feeling the long COVID symptoms and why you're not getting better. If we understand these, we can appreciate the way to tackle and overcome the issues of long COVID. Now, at the beginning, right at the beginning of the life curve, we're thinking of optimal health. Now, this is when you are born, a beautiful baby, born all healthy, everything's functioning to the best of its ability. The organs are functioning well, the physical, mental, and spiritual well-being is as best as it can be. Now, life goes on and things cause deterioration in your body. We've got to think about some bugs. When you've been traveling, you've caught a bug, or the skin is wearing down, you've had some injuries and operations. You might have lost your appendix in an operation, or you've had your gallbladder taken out. Things happen in life, and this curve goes down to ultimately death. Everybody's going to die at some point, and no matter what age you're at, you've deteriorated compared to when you were born and fresh. This normal health curve, it often deteriorates very fast, and unfortunately in the current medical model of health, it's considered normal to have a lot of functional impairments. So fatigue, it could have been going on, and a lot of people struggle with fatigue or digestive disorders. They've got bloating and gas or burping. Obesity is a big one. This is quite common in American culture and Australian society right now. Obesity is quite normal. And you might think yourself, well, I do carry a few extra kilos, I've been meaning to lose it. But this is functional impairment that's been going on for possibly decades. Thyroid dysfunction, you may already be taking medication for thyroid issues, or mood disorders, struggling with anxiety, depression, etc. So these are functional impairments. They may not be something that's been currently addressed by your doctor. They may have just been there in the background, that you just knew something wasn't really optimal compared to when you were a teenager or even as a baby. Now, these progress further as time goes on into disease. And this is where you may have seen your doctor previously before long COVID and getting COVID. And these are really things like diagnosed diabetes or heart disease or arthritis or even cancer previously, but there's a deterioration on a biochemical level in your body. And this has happened the decades before actually getting COVID or having long COVID after the vaccination. And these things cause the deterioration on a cellular level and a function of your body. Now, there are two lines on this page. First of all, there's the deeper one, which is a faster progression. And we're often on this slippery slope in society. We've got a lot of these issues already established and happening, whereas someone else might be really optimal health. They've been doing yoga or exercise every morning. They've been having exceptional food. They take supplements and they're on the higher functioning level where their liver is functioning at optimal level, or their kidney function, or they're not overweight and they don't have excessive inflammation. Now, when COVID comes along, or it's the vaccination that's causing the long COVID, we could call this a level of toxic impediment on the body. I'm not going to get too much into that of why long COVID is caused. We can get into that into another video, but basically when this trigger has come in, it's just another stack onto the already depleted things in the body. So your body is already suboptimal level of liver function, you've got leaky gut, and you've got a disrupted microbiome, and the immune system is not functioning at the best. And then this is just one more trigger and one more push, which burdens the body, and it just has had enough. And this is where we've got the long COVID lingering, and you've got all these symptoms of the body ache, the poor sleep, and the fog that's just hanging over your head. So looking at the big picture, was it the COVID or the vaccination that is the main issue? Or is it a combination of all? It's clearly the combination of all. And this is why you're not getting better. This is why you're stuck stagnant, because we have to unpick the different components of that that's contributing to the top of the iceberg, the tip of the iceberg, which are the symptoms that you're experiencing. Now, I wish it was as simple as just getting one thing. It can be reducing the inflammation, or it can be supporting cardiovascular function or detox channels or microbiome, but it's usually a combination of each. And depending on how deep ingrained those things are in your body is going to depend on how long does it take. Now, naturopathically, we say for roughly a year of something, it'll take a month of treatment as a rough rule. But if you've had diabetes and you've been taking metformin for 10 years, there's been something that's been ongoing for a long time that needs to be unraveled. And this will take a lot longer than someone who has just suffered a hit and then they've dropped down and have had some brain fog for a short period. Now, we have to think about also the limitations of conventional medicine currently. Now, you may have already seen a regular doctor. You've read some stuff about what you could do for long COVID. And what's the reason why that has limitations is because it's not addressing all those underlying things under the contributing factors to the tip of the iceberg. And this is why long COVID is lingering. So they might just throw antidepressants at you. Well, you've got the brain fog, or non-steroidal anti-inflammatories. You've got some inflammation. That's why you've got body ache. Let's just give those. But then that's going to weaken the microbiome, and that's going to put more pressure on your liver detoxification channels. So these things, they're not going to work. And that's probably what you're experiencing, is you're trying these things and they're not really working. And it's the months are going on and you're wondering, when am I even going to get better? So this is exactly the reasons why. Now, if we look back at this chart, we want you on the optimal function, top of the curve, and then your body will be able to deal with these viruses or toxins from the COVID vaccination or whatever the cause is of the long COVID. And when we're functioning in the optimal way, then we don't have the brain fog, we don't have the inflammation, we don't have the cardiac markers, unless there's ultimate damage on a cellular level where the function is completely obliterated and it needs to be removed, like the gallbladder or the appendix, for example. Now, I'll just touch on also about viruses in general. If this COVID is not new, we could get into the complexities of the spike protein, and this is a more severe virus, or whatever the case, or this is the COVID with the graphene oxide, but what's the past is the past. If you've already had that vaccination or you've already got it, we just focus on the solutions now and the solutions moving forward. But through time, this is not new. We've had other viruses, we've had other toxicities. We can get into the polo, but a common one is the Epstein-Barr glandular fever. Now, this is a really common one, or even herpes virus, where people get cold sores on their lips. This doesn't go away. And if we look at different people, you may know different people in your family or partners or relatives. Some people get them every couple of weeks. They're so depleted and they're getting a sore on their lips, or they're getting really run down with fatigue. And then they run the test, or they just know they've got a cold sore, and they keep getting these outbursts when they're run down. Whereas someone else might have herpes virus or glandular fever, and they just run on life normally and they never get them. They never get a sore, maybe once every 5 years or once every 10 years. What are the differences between those two people? Well, it's the life curve. One is functioning at optimal level and one is depleted a lot, and they're just so burdened with the viral load or toxicity or a combination of things that they're not recovering out of that. They're not getting back to the balance of equilibrium. Now, I'll just show you another page, which I often talk about with patients of solutions. Your health is a combination of emotional, environmental, diet, physical body, and genetics. 5 basic pillars which contribute to the ultimate you. So you could look at what particular areas for you are contributing to that. Is it a bit of everything? It generally is. Or for you, is it more emotional? Are you trapped in a bad relationship or something that you can't get out of emotionally? This is going to drain you and bring down your stress, or bring up your stress levels and make your whole body function at a lower level. Is it environmental? Are you in a toxic environment with pollution all around? You don't have a water filter and you're burdening your body with even more toxicity in addition to a COVID vaccination or spike protein or whatever. Diet, is your diet at optimal levels? Are you eating the ultimate, cleanest, less burden with preservatives, pesticides, and all other toxicities? Is it the highest quality to feed your body? Physical body, is your biochemistry working? Is your probiotic, your microbiome? Is your sleep in order? Is your body functioning? Have you got enough fiber? Are you drinking enough water, etc., for your body function to be optimal levels? Or are you carrying excess 10 kilograms? And genetics, we can get into some genetic predispositions, but we could talk about epigenetics. But are you favoring your epigenetics to not switch on those switches? Do you have the MTHFR gene, which is burdening and making the toxicity and the methylation worse? We can work with those genetic predispositions to improve the function. Just because you're dealt some cards, it doesn't mean you have to play out those cards and be struggling. You can switch those switches on and off with the epigenetics. But those things are contributing to you going up to the top of the life curve and overcoming long COVID and being the optimal functioning body that you can. Now, what would I do? What would I do with patients? Well, I would do all of this. I would look at them as an individual. I look at you as an individual, and we discuss these areas. Is your microbiome health fine? Some people have great digestion. They're going to the toilet every day. It's fine. It's functioning. Probiotic picture is really optimal. Or is your diet really poor? Are you making the wrong choices because you're so fatigued, you're drained? How do we improve that? Could I make a diet plan for you that's simple, that you could follow, and then that slowly lifts you up to give you more energy? Do you have chronic inflammation? Is that contributing to the brain fog? Could I give you some specific herbs to help you get out of that inflammation, reduce the brain fog and the body aches, so then you're able to move more and maybe get into the sunshine more and get moving every day, and then slowly spiral out of that long COVID? It's not one thing. I have to keep saying, we have to be brutally honest. It's not going to be one magic thing. Here, take some turmeric, or here, have a smoothie every day, but they're all contributing to get you up to better function, and then with better function, you're able to do more and more. This is what I would do with you, give you an individualized plan and help you get up to that life curve at the top. Now, I want you to keep learning, so you've got to keep watching these videos. Watch this one right here, and I'll see you in that one.